Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. Omara, who is a resident currently in a general practice resident. So she's going to give us a little bit of insight into what that is, as well as her dental journey. So welcome, Dr. Omara, and you can go ahead and take the stage.
Okay, thanks, Hannah. And I just want to say thank you for inviting me to do this presentation. So like Hannah said, my name is Dr. Geraldine O'Mara. I'm currently GPR resident here at Michigan Medicine. A little bit about me. I'm originally from the Bay Area. My hometown's Vallejo, California, about 40 minutes north of San Francisco. I attended UC Santa Cruz for undergrad, where I majored in MCD biology. And then I went on to do dental school at the University of Michigan, where I graduated in 2020. And now I'm a resident here at Michigan Medicine, our main hospital, doing the GPR residency. Okay, a little bit more about why I went into dentistry. It was the summer after my freshman year of high school. My best friend, her mom was a general dentist in our hometown, and she had a private practice, and we didn't have anything planned for the summer. So we used to just shadow and kind of help out at her office. So that's kind of what got me interested in dentistry. I knew I always wanted to do a career in healthcare, but had more of a focus on wanting to go to med school. But it wasn't until I actually started undergrad at Santa Cruz that I kind of started looking into the different pre-health orgs that they had at Santa Cruz. And I stumbled upon the Pre-Dental Society and got to know a little bit about them and what they do. And that's kind of what sparked my interest and want to go into dentistry. So this slide just shows a couple of pictures. When I was involved in the Pre-Dental Society, we used to do tabling around campus, kind of, letting people know about oral hygiene. And then we used to do a lot of events with some of the dental schools in the area. So we often went to UCSF and participated in events like Give Kids a Smile. So it really got me to see more in depth about dentistry, and that's really what fueled me to want to pursue a career in it. Okay, so kind of the prep work that went into it. When I was in undergrad, I tried to stay really busy. I was always involved in a ton of extracurriculars. Some of the things, like I was always on board for the Pre-Dental Society, and I was an orientation leader for my college that I was a part of. And did volleyball intramurals, so a bunch of different things. I always tried to pick things that I was really passionate about. So, that's definitely what you want to do on top of studying, is make sure you're well-rounded and, just having some fun on top of school. And then also when it came to preparing more for dental school, I took my DAT this summer after my junior year of undergrad. Kind of gave myself the whole summer to study and took the exam right at the end. So I just listed a few of the study materials that really helped. I took a Kaplan course. I'm kind of a person that likes, all the material kind of presented to me. So that helped me a lot. So after that course was done, that's when I used a lot of these other materials, like DAT Bootcamp was really helpful, Chad's videos, the DAT Destroyer. Those were pretty tough questions, but I thought it was really helpful. And then in the week leading up to my exam, I found a lot of past DAT exams that had been released. So I kind of used that as my last minute prep for the exam. So after taking my DAT, it was my senior year that I applied to dental schools. I applied to 12 schools in total, mostly in California because that's where I'm from, but I also applied to a bunch of schools around the country. The way I picked the schools was I pretty much tried to match my GPA and DAT scores to the averages of those schools. But then I also threw in a few schools that were kind of a bit of a reach for me as well. Okay. So I ultimately ended up choosing to attend the University of Michigan, moved out of California and went to the Midwest. Some of the things that I really liked about U of M was that we do get a pretty early experience in clinic. By the end of our D1 year, we were already in foundations clinic, practicing on classmates and, starting prophies. So they really get you into clinic early, which I loved because, I was always more into clinic than lecture courses. So I enjoyed that aspect. Also, we have great faculty and alumni at U of M. Even now, almost being a year out of dental school, and I'm currently applying for jobs now that my residency will be coming to an end. And I mean, there's so many faculty and alumni that I reach out to on a daily basis, and everyone's always willing to help. So you definitely have a lot of really great support. I enjoyed a lot of the student orgs that U of M offered. All 4 years of dental school, I was on board for student council. So, that kept me involved with the dental school. And then I was a board member for, I believe, 3 years with one of the dental fraternities that we had, Delta Sigma Delta. So, that kind of made dental school fun and gave me something to do outside of studying and schoolwork. Another great thing about U of M dentistry is we do have pretty much all the specialty programs at the dental school. I know a lot of dental schools don't really have that. So it gave us the opportunity to do a lot of rotations with the different specialties and, really see what the different specialties are like and be able to work with residents, which kind of made, my classmates and I more prepared to, go on to post-grad programs or even specialize. So that was great. Mentoring, I always felt, especially when I was a D1 and D2, that there were always upperclassmen that were around and willing to help, whether that be, just giving you advice about classes or if you wanted some help when it came to, sim lab and doing more of the clinical stuff. So definitely a really good community at the dental school. And then D4 rotations, which I'll kind of touch bases on a little bit later in the presentation. Your D4 a year, we have it set up that we go on 12 weeks of outside rotations at clinics around the state of Michigan, which was great. It was a lot of great experience and clinical time. So that was definitely a pro for me with U of M. Okay, so next I'm gonna just kind of break down the curriculum a little bit. Not too much detail, but for D1 and D2 year, you basically spend a lot of time in lecture courses, doing all the basic sciences. And then you are spending time in sim lab. I kind of have a picture from, I think it was my D1 year, doing restorations, practicing preps. So, most of your time is in clinic, but you do have a lot of time where you are doing, your preclinical foundation courses. And like I was saying earlier, U of M, we start patient care pretty early at the end of your D1 year. And then By the winter of your D2 year, you get assigned to patient families. So that basically means when you start clinic, your D2 year, you have a D3 and a D4 that will eventually pass you down patients, which is great because you have two people that you can learn more about the patient, and it's not like you're just grabbing patients from, patients that you don't know. So that was really nice to kind of have that support as well. And then D3 and D4 year, you're basically in clinic a lot. D3 year, you still do have some lecture courses. So you kind of spend half your time in lectures, half your time up in clinic. And then D4 year, you're pretty much just in clinic and doing your rotations like I was talking about earlier. So 12 weeks in community-based dental clinics around Michigan. I felt like I got a lot of experience out of those rotations because when you're in clinic at the school, every step of procedures, you kind of have to check in with faculty, and they're very much watching everything you're doing. Whereas when you go on these rotations, you'll have a preceptor there that's overseeing you. But you gain a lot of independence. So that kind of built my confidence when it came to clinic. So yeah, that's my mom. She came and was a patient of mine my D3 year. And then this is my dental school class. I think that was our last final of dental school. So they always take a picture of the class at your last final. So okay, so as I was saying, I'm currently doing a 1-year GPR program. So I am a general dentist, but this is, a post-grad program based in a hospital. And our main patient population are special needs patients, patients with, pretty complex med history. And we do see a lot of head and neck cancer patients. OMFS is part of our department. We work alongside them. So we do see quite a bit of head and neck cancer patients. So typically in hospital dentistry here at U of M, there's different parts of the hospital that us residents will treat patients. One being outpatient, where we see patients in clinic. So it's kind of just a normal clinic setting. And then we also see inpatients. So each week there is a day call resident who is on call for the day at the hospital. And you basically get consulted by all the different departments here. You can get called to see patients in the ICU, on the inpatient floors. A lot of times we are doing, let me just pull this off. Yeah, so a lot of times we get consulted for patients that need a clearance, being that they might be going for cardiac surgery or trying to get on a transplant list for like lungs or kidney. So dentistry typically is part of the checklist of their inpatient team to get them cleared for these procedures. So if the patient is able to be brought down to our offsite clinic, they'll be brought down by either transport, or if they're really sick, we have a specialized team of nurses here at the hospital called our SWAT team, and they will transport the patient down to us, and we typically get a pan and do a quick exam for them. And if there's any treatment that they need done to get cleared, we'll set that up. If the patient is, say, in an ICU or intubated, or just can't be transported down to our offsite clinic, we do have a portable x-ray machine. It's called a Nomad, that will bring up to the patient in a room, and we'll just take x-rays bedside, do the exam, and then kind of go from there. So it can get really busy. There's only one day call resident a week, so your pager's going off quite a bit, because a lot of patients here at the hospital need some type of dental consult. So if you're not seeing inpatients or outpatients, you can be in the OR. Typically, we have ORs on Tuesdays, Wednesdays, and Thursdays. And a normal OR day, you at least have 2 patients that you're seeing. Sometimes there can be 3. And these patients typically tend to be really medically complex, special needs patients that, could not be seen in a clinic setting. We do have some patients where we're able to give them oral sedation, or they can just, handle dental care in a clinic. But our patients that, that's not possible, we submit case requests to see them in the OR, and we're able to do a comprehensive exam. We do x-rays, cleanings, restos, and extractions. There have been a few cases where we were able to do endo on patients. But in those cases, it's pretty much only if it's a patient that can be followed up in clinic for the restorative part of it. And then we also see emergency department patients. So every night there's a resident that's on call from 5 p.m. until 8 a.m. And we see everything from facial swelling patients to trauma to dental pain. So we pretty much get anything and everything, because we're, I think, one of the only hospitals in the state of Michigan that has a dental team on call for emergency patients. So we get patients that are transferred from up north in Michigan, all the way from patients coming up from Ohio. So we get quite a few patients that come into our emergency department. Okay, so a little bit more about the GPR here at Michigan Medicine. So like I was saying, it's a postgraduate program. It's not a specialty, but once I am done with the program, you do get a postgrad certificate. So when you're not seeing patients like I was just talking about, there are rotations that we have to go on. We spend 4 weeks with OMFS, helping out in their clinics, going to their ORs. So you get a lot of experience with that. And then we do have a 3-week rotation with anesthesiology, which I just finished mine last week. So during that rotation, you get trained on intubating patients, masking patients before ORs. They will teach you how to do place IVs and all about the anesthetic drugs. So that was a really cool rotation, because when do you ever get the chance to learn how to intubate a patient? And then we spend 2 weeks on an emergency department rotation. And basically you follow emergency department resident or attending, and you see whatever comes into the ED, from trauma to just a patient that's not really feeling well. So it gives us a chance to see other emergency patients that are not really dental related. And then we do a 2-week rotation with the oral facial pain clinic. We have, I believe, 3 specialists here, part of our program. So it's a great rotation, because in dental school you don't really get too much training in oral facial pain and TMD problems. So that's nice to be able to get that during residency. And then we do a 1 week health and physical rotation, and that helps us, especially for our OR patients. Before each OR and pre-op, it's up to us residents to complete a health and physical before the patient is brought up to the OR and the case is started. So on top of rotations, there's quite a bit of continued education. Each week we have lectures and seminars, sometimes in the morning, sometimes at the end of the day after patient care. And we have a lot of great specialists that come in, and we do a lot of literature reviews. So that just kind of helps to, continue your dental education following dental school. And then this program, it's a little weird with COVID, but in normal times, there are a lot of conferences that we're able to attend. Like this week, our OMFS department is putting on a Women in OMFS conference that's nationwide over Zoom. So that'll be happening this weekend. And then following a GPR, if a provider is really passionate about hospital dentistry, doing a GPR kind of sets you up to be able to get hospital privileges if that's something you want to do in your future in your practice. So really sets you up for that. Okay, so I'm just going to go over a few cases, not too much detail, but just kind of some of the typical things that we see. This patient in particular came into the emergency department last week. He's a special needs patient. He has a permanent trach. He's nonverbal and is wheelchair bound. He had, a bit of an accident where he fell down some concrete stairs and had quite a bit of facial and neck lacerations. He had a avulsed, I believe, tooth 7 and 8 were completely knocked out, and number 9 was luxated. So in this picture, one of my co-residents who was on call that night that he came in, she actually extracted tooth 9 while he was in the resus bay. So he's missing those 3 teeth from the accident. And then another thing that happened was he had a right maxillary fracture. So, the bone was kind of mobile. So because he was a special needs patient, after talking to his inpatient team and talking with our dentistry attendings, the decision was made to, keep him and to have the procedure to reposition everything and suture the area in an OR. So he did go under general anesthesia just because of, his health needs. It was better to do it in a more controlled environment where he wasn't really aware of what was going on because, already went through a traumatic event. We don't want this to be even more trauma for him. So he came in Thursday night, Friday afternoon. We had an urgent OR with him. I completed this case with one of my attendings. So we basically, after he was intubated and put under general anesthesia, we basically repositioned that alveolar fracture that he had. And we did that by positioning it into place and using some ortho wire to splint his full arch and keep it in place. The patient does, has a history of a narrow arch, and he also has a pretty big open bite. So because of that, he's only biting on his back molars. So in order for him to, not create more trauma to his alveolar fracture, we put a little bit of composite on the occlusal portions of his right molars, so that he's biting, or his left molars, so he's biting down on that and not causing more trauma to his right side. So after we splinted everything into place, we kind of opened a flap and, kind of released his gingival tissue so we could go in there and make sure to, debride and get any dirt or cement that was still left in there, clean that out really well, flushed it with sterile saline, and then sutured it back into place. Because typically he's a patient that we can see in clinic, we will be following up with him as an outpatient. So after the surgery, he actually didn't even stay at the hospital. He was discharged with his family. So he's a typical patient that we'll just follow up with in clinic and monitor him. And if you guys have any questions about these cases afterwards, feel free to ask. Okay, this is another patient of mine who I see as an outpatient. So a little bit about her. She has a history of squamous cell carcinoma of the right maxilla. So years back, I want to say it was in 2006, she had basically she had a maxillectomy where they resected that portion of her maxilla that developed the squamous cell carcinoma, and they ended up taking a flap from her leg and reconstructing the area. So she doesn't have bone up there on the right side, but it is reconstructed with soft tissue. So as you can imagine, not having that portion of your maxilla will affect the way you talk, the way you eat, and the way you drink. So we're actually working with her outside. She does have an outside general dentist. So he's kind of helping us with restoring her mandibular teeth. Whereas our clinic with hospital dentistry, we will be fabricating an obturator for her. So obturator is basically a prosthesis that helps to repair, any palatal resection. Sometimes these patients, she's not one of these candidates, but there are some patients where you're not able to fully cover the palate. So they do have exposure to like their nasal cavity. So an obturator is a prosthesis that can be made to kind of close that area. So right now, I actually saw her today. We're in the phase of we took her final impressions today using a custom tray. And I'm going to be working with our prosthodontist, Dr. Hawk, who comes in on Fridays. I'm kind of working side by side with him to fabricate a nice obturator for her. And once that's done, she'll be seen by her general dentist to complete rehab of her mandibular teeth. The one thing for this patient that's a bit unfortunate is she'll never really have full function of her upper teeth. We had to make her aware that, even though we're making this obturator for her, it's going to be more for aesthetic reasons. It'll never give her the full function of being able to, like eat steak or anything hard like that. But at least will help her with her speech. It'll help her with lip support, and try to give her somewhat of normal appearance. But function wise, it's not really going to be used for that. So yeah, this is kind of a typical case. We do see a lot of these head and neck cancer patients who our OMFS colleagues will treat in an OR setting, and then it's up to hospital dentistry as an outpatient to kind of help with the rehabilitation process. So that's been a really cool part of our residency. And when you finish cases like this, it's really rewarding. So, okay. So just some advice from the many years of undergrad dental school and now doing a residency. I always tell whether you're in high school, undergrad, or even in dental school, always network. I don't think I would be, here today, done with dental school and now in residency without, meeting people at conferences and developing a lot of great mentors along the way. That top picture is at one of the special needs conferences I attended in dental school, and got to meet a lot of people, a lot of program directors that helped with when I was interviewing for GPRs. So, just getting out there and, like I said, getting involved, joining organizations, and, that process will help you kind of solidify how you want to move forward in your career. So, yeah, definitely find great mentors, get involved, and try to network. But then also, last takeaway is make time for yourself. It can be a long process, getting through the whole healthcare profession. We spend a lot of time in school and, trying to achieve all these goals that we set. So it's important to make time for yourself, make time for friends and family. I put in a picture of one of my friends. He got married towards the end of dental school. So this is just a picture of a group of us at his wedding. So I think it's really important to make time for friends and to really enjoy the process. It can be a long process to, go through dentistry, medicine, or, any health career. So I think that is it. Yeah. Does anyone have questions?
We have some questions in the chat for you. The first
Perfect.
question was, what made you decide to do a GPR rather than, doing a different specialty?
Yeah, I think so. Like I was saying earlier, when I was younger, I knew I wanted to go into a healthcare profession, and I was always really focused on going into medicine. So when I started dental school and kind of heard a little bit more about the hospital dentistry side of things, I was like, whoa, that's perfect. That kind of mixes medicine and dentistry together. So that was kind of my main thing. So I kind of knew that I wanted to do a GPR since my freshman year, and that kind of goes back to one of the perks about going to U of M is we do have a hospital dentistry program associated with the dental school. So it gave me that opportunity to learn more because when I was entering dental school, I didn't even know hospital dentistry was a thing. So, yeah.
Awesome. And then another question from the chat was, how did you make yourself a competitive applicant for dental school?
Okay. Yeah. So, one thing that I kind of really centered my application on was the fact that, I did start shadowing a dentist, since high school, since my freshman summer. And I did that every summer, and I continued to work for her as I went into throughout undergrad. And even in the 1 year I took off before dental school, I worked full time with her as an assistant. So I really focused my application more on the fact that, I had a lot of experience with the field of dentistry before even applying. Like I was saying, I spent a lot of time focusing on extracurriculars. So that was a big portion of my application. And then also, too, at the end of the day, you need to study hard and, try to do the best in classes. And although you don't need to, major in a science, that's definitely helpful. A lot of the courses in dental school were just kind of the same courses that I took in undergrad as an MCD bio major. But again, you don't have to go that route. I had classmates that were lit majors and every type of major, but I definitely think for me personally, being a science major helped with, the application process and everything. So.
And then another question in the chat was, what are your plans for the future? For example, do you plan to open up your own practice or something like that?
Yeah, so I'm over halfway done with my residency now. My last day of residency is June 30th. So I've been in the whole job search process for the last couple of months. I've mainly been applying for jobs back in California. Right now, I'm kind of just focused on going into private practice. So I'm looking to join a practice as a general dentist. That's my main focus right now. But in the future, as I get more experience as a general dentist, I wouldn't mind, sticking or doing half time with hospital dentistry, whether that be, trying to become an attending at a program, or even, maybe in the future getting hospital privileges to do cases at a hospital. But for right now, I don't see myself specializing in anything. I love all aspects of general dentistry. I really enjoy pros and the oral surgery side of things. So I really don't want to limit what I can do. So
And then another question here was, what advice would you give to your younger self?
that's a good question. I think I would definitely tell myself to kind of enjoy the process. Now that I'm at the end of my residency program, I look back and think, wow, even just making this presentation, thinking how quickly undergrad went, how quickly dental school went. So there's times that I look back and I'm like, oh, I wish I wasn't so stressed and, just had or enjoyed the process a little bit. But then I also think, I wouldn't be where I am today if I didn't put that hard work in. But yeah, I guess if I was to give myself some advice, it would just be to, not stress too much.
And then another question here was, what recommendations do you have for finding a job after dental school?
Yeah. Okay. So, I, of course, first started by just looking online with some websites. There's websites like Indeed, where a lot of practices will post jobs. Like I mentioned earlier, I reached out to faculty and alumni that I knew from U of M dentistry. For example, I had one clinic faculty that I was really close with, and he was actually the lead faculty of my dental fraternity. So I reached out to him. He had so many connections. So I was just like, do you know any alumni that are out in California? And he got me in touch with quite a few that were extremely helpful. And then there's a few other sites that I've used. There's DDS Match. It's basically like just a database where you can submit your resume and give, background on yourself. And from what I heard, dentists all over the country pretty much know about it, and they can basically put in, where their practice is located, and it'll show whichever applicant is in that area and had submitted their resume. So I did that, and I've gotten contacted by a few people through that. And then another thing I've been doing is I'm applying more so in the San Diego area. So I looked into the San Diego Dental Society, and their website actually had a resume bank where you can submit your resume there. And I've gotten a few calls from dentists out there who had seen my resume on the San Diego Dental Society. So there's a lot of different avenues. It's really just getting your name out there and letting people know who you are. So.
And then a question here, if you were to answer the dental school interview question, why do you want to be a dentist? What would be a good answer that stands out from others?
Well, Well, I think this is an answer that I used when I was applying, kind of going back to when I thought I wanted to go into medicine. The biggest difference that kind of drove me to go towards dentistry was, you really you get to have that patient provider relationship in dentistry. I feel like a lot of patients that I see, once they get comfortable with you, they come in for their appointments and they just want to talk to you and tell you all about their kids and what they're doing. Whereas, just with how healthcare is now, medicine, you don't really get to have that relationship with patients. So dentistry, it's like you're not only treating a patient health wise, but you also have that time to get to know them. And, in private practice, if you have a patient that you see throughout the years, you really do build that bond with them and you get to know their families and everything. So, yeah, that's kind of what I liked most about dentistry, is really getting to know who you're treating.
And then another question, what is the scope of practice for general dentists as opposed to specialists?
Hmm. So for general dentists, you can basically do everything. You can do restorative, you can do endo, oral surgery with extractions, basically anything you're comfortable with seeing and that falls under your license. Whereas if you go on to specialize, say, in to become an endodontist or a periodontist, once you finish that program and you get licensed as a specialist, you have to stick to that specialty. So you won't see like an endodontist going on to do extractions or do fillings. So it does make you a little bit limited in the scope of what you can do. But from friends that I had in dental school that have gone on to specialize, that's what they wanted. Like, I have one of my best friends, she's doing peds right now, and she loves working with kids. So that's kind of her calling, and that's what she wants to do throughout her career. So yeah, it's just kind of keeping it in mind that, your scope of practice will be a bit limited, but patient or that's what people wanted. Some people want to do, whereas general dentistry, you will have the opportunity to do, all the different types of procedures you want. So it's kind of the big difference.
And then is a GPR like paid?
Yeah. So I don't think I don't know. So I only applied to 3 GPR programs, and all the ones that I applied to, I do get paid, or you do get paid at them. Michigan, I do get paid monthly. Whereas I know a lot of the specialty programs, residencies, there are some where, you get a stipend, but I think for the most part, a lot of them, if you go on to specialize, there is tuition. But yeah, the GPR that I'm in right now, I do get paid.
And then what would you say, if you had to say, were there any cons of Michigan?
Um, a few cons. Okay, well, one, this is a con, but it was also a pro of mine, was the fact that we do have all the graduate programs and the specialty programs at the dental school, where it was great that we got a lot of experience with these specialties, but it was also kind of a con because a lot of more complex cases, dental students wouldn't be able to do them. They would get referred to the residents in programs. So that was a little bit of a con. So both a pro and a con. Another con would probably be, this isn't going to last forever, but halfway through dental school, Michigan started remodeling the dental school. So they have a huge, like, multi-million-dollar construction going on right now, to where they're redoing the clinics and, just remodeling the school and updating it. So my class got impacted by it a little bit throughout dental school, but I know right now, the current classes, on top of COVID and everything that's going on, it's kind of not the normal dental school experience because everything's shifting. So I would say that's a con, but again, it's bettering the school, so it's not going to be like that forever. So yeah.
And then also, in regards to like your future goals, do you think that
Mhm.
you'll ever, I guess, this question is kind of like asking if hospital dentistry is like a thing, that you can just be a hospital dentist?
Yeah, so my attendings here at the program have, picked a career in hospital dentistry. So my program director, that's her career. After dental school, she went on to do a GPR and then ended up becoming the director of the Michigan program. So her career has been focused in hospital dentistry, along with, two other of my attendings. So yeah, it's definitely a thing. It's, I don't want to say there's a ton of hospital dentistry jobs around. Like I was saying, U of M is pretty much one of the few programs here in the state of Michigan. So, um, yeah, I mean, it's not something that you see everywhere, but yeah, if you did want to make a career out of it, it's definitely totally possible to do. So, because we're seeing a lot of patients that, outside general dentists or, just private practices, they don't have experience treating these patients, or they just don't have, um, the facility to treat these patients. So yeah, it can definitely be a career if you want it to be. So
And then another question was, what are some things you think that Michigan was looking for in applicants?
yeah. So yeah, Michigan, I feel like they were definitely looking for well-rounded applicants. We I forget how many people applied when I was applying, but yeah, I can't remember the exact numbers, but Michigan does get a high amount of applicants. And from my class, like I was saying earlier, we had students from like all walks of life. We had people majoring in every type of major. We Just to give a few examples, I had a classmate that was a PA, like had a career as a physician assistant before coming to dental school. We had a ton of athletes in our class. So a lot of people that were from all different walks of life. So I would say, they definitely wanted someone who academically was, uh, strong in academics, but they also looked at applicants as a whole. And look, that's why I'm really big on extracurriculars, because I definitely think that helps. And then I know Michigan, like one of their priorities is diversity. So a nice thing with them is I think half my class were in-state students here from Michigan, and then half the class was from out of state. Um, so yeah, no, I felt like they really look for well-rounded students. You don't have to be the smartest straight A student, but and they definitely want people who, care about patients. I think it really comes out in your interview if you're coming into dentistry for the right reasons. So yeah, they looked for all around great applicants. So
And then a few questions that kind of tie in together. Did you
mhm.
have other dental schools that you wanted to go to besides Michigan? And like a little bit about your acceptances that you had gotten and ultimately like why you chose Michigan?
Yeah, so Gosh, it's been a while, so I'm trying to remember where exactly I interviewed at. So like I was saying, I applied to 12 schools, mostly in California. One of my other top pick schools was UCSF, just because I'm from the Bay Area and it was close to home and kind of part of the UC system since I went to Santa Cruz. So that was a top school. I didn't end up getting an interview with them, but I did get an. Where else did I interview? Okay, I interviewed at Lecom in Florida. I had an interview at Western in like the LA area. I went out to ASDO in Arizona, Michigan, and I think I got a few other. I think I got a interview at USC. A few other interviews came after I had already accepted Michigan. So I never ended up going on those. But I think out of all the interviews I went to, something just felt right about Michigan. I had heard a lot about Michigan. One of my mentors in undergrad who started our pre-dental society went on to do dental school here at Michigan. So he was kind of the one that was like, it's a great school. You definitely need to apply. So Michigan was a top pick of mine, and I would say it was the one interview out of all my other interviews where I just felt like, the interview went really well. I liked the school. I liked all the people I met there. And it was the first school I heard back from. So it was kind of hard to turn down when I got the call saying I was accepted. And, a big component of why I did choose to go to Michigan was, even though I was an out-of-state student coming from California, it was cheaper for me to go to Michigan Dental rather than go to any of the California schools I got into, because a lot of them were private, and so tuition was much higher. Michigan helped with cost as well. So because when you're an out-of-state student at a school, tuition's higher. But the fact that Michigan was cheaper than some of the California schools helped a lot. So, yeah.
And actually, to kind of piggyback that, do you have any advice for the financial aspect of dentistry? Like, dental school is not cheap. So, yeah.
Yeah, no, it's very much not. I've just started paying back student loans, so I definitely understand. So there are a few options. We had quite a few students in my class that went on to, they applied and received the military scholarship. So you can do that through like the Navy, Army, Air Force, pretty much, I think, all branches. So there's that. There are some other there's a ton of scholarships that you can apply for. You kind of have to look into them. And a lot of schools do have scholarships. Like Michigan was awesome. I, along with a ton of classmates, did receive some money from Michigan through scholarships. So that helped. But other than that, from a majority of my classmates, a lot of us had to take out loans. It's just really expensive. We go through 4 years of undergrad. So I would say almost probably all students, there might have been a few outliers, but most of us did take out loans. But I think, dentistry is such a good field that, even though the schooling is expensive, once you do graduate and start working, you're in a pretty good position where you'll be able to pay off loans. So, that's always something to kind of keep in the back of your head, that, you might not pay it back all at once and right away, but you'll be in a good position once you graduate to start paying off loans. So.
And then kind of talking about the benefits of a GPR, do you think that it kind of like helped you, I guess, hone your skills more and practice dentistry so that you could be a better general dentist?
Oh, for sure. Yeah. It's a pretty I'm not going to lie, this program is pretty stressful. Like I was saying, we see a lot of special needs patients, a lot of really medically complex patients that none of us got experience with. But, my other four co-residents, we didn't have experience with patients like this in dental school. So it was a huge learning curve, coming into this program. And, right out of orientation, we were in clinic right after COVID. I think all of us had, a bunch of time off because of COVID. And then, starting this program, it was, yeah, like I was saying, a huge learning curve. We have a ton of experience with oral surgery here, with extractions, in clinic and in the OR setting. A lot of our OR cases end up going into full mouth extractions. So one thing I've definitely gotten, a lot of experience with and built confidence is in extractions, whether, simple extractions all the way to more complex surgical extractions. I've gotten so much experience that I don't think I would have if I went straight from dental school into working um, like at a private practice. Also, like I was saying, we see a ton of inpatients that are, again, super medically complex, and we get to work with all the inpatient care teams. So, we've gone to learn like what labs to order, what to look for in our patients before we treat them. We've learned so much about meds and even the patients that we see in the emergency department. A lot of them will get head and neck CTs. So basically all of us, myself and my co-residents, were pretty competent at reading head and neck CTs now. So yeah, just a ton of stuff that I would have never gotten experience with. And, even though it is stressful and you're on call a lot, and we don't have set hours, which I can kind of talk a little bit about. I meant to talk about in my presentation. Typical day, if we have seminar or a case review in the morning, we have to be at the hospital by 7. If it's an OR day, you have to be at the hospital by 6 and ready to see your patient in pre-op by 6:30. So we start pretty early. And, if you're in the OR, you're either doing, it can be 2 to 3 cases. Whereas if you're in clinic, you're seeing patients all morning, you have an hour for lunch, and then you're seeing patients again in the afternoon. And then some days it can be you're going straight to a seminar right after patient care, and then you can be on call that night. So if you're on call, you start at 5 p.m. And if it's a crazy night in the ED, you can you can literally be here at the hospital from like 7 in the morning all the way until midnight or past that. And it happens sometimes. So yeah, it is stressful, but you get so much experience. And I definitely think myself and my co-residents, we all feel that once we're out in practice, 2 of my co-residents are going on to specialize. But I think any patient that we see outside of our program will be able to handle, because we've seen a lot of stuff here. So yeah, definitely prepares you.
And then I know the journey carries a lot of stress. So what has been something that has been able to relieve your stress?
Yeah. Again, it's really hard with COVID. It's just kind of not a typical year of residency. But now that myself and my co-residents were all vaccinated now, we've kind of been, just doing dinners every couple of weeks to just, kind of go out and not really think about work. So that I try to work out every day. That kind of is my stress release. And just keeping in contact with friends. I'm still close with a ton of classmates that are all over the country. And so just making time to text them or FaceTime them is really nice, because, I do have friends that are out in private practice and others that have gone on to do residencies. And even though we're all in different areas, we are all still kind of going through the same thing. So it's nice to know that there's other people going through the same thing with you. So, yeah.
And then our last question for you is, what is your favorite procedure to perform?
That's a good question. I've never really thought about that. Hmm. Um, like I was saying earlier, I really like all aspects of general dentistry. This program, like I was saying, we do have a prosthodontist that comes on Fridays, and we do really kind of complex pros cases. So I feel like I've gotten a lot of experience with that, and I'm really enjoying pros. So I do enjoy that for kind of the outpatient side of things. I really enjoy the OR. Just being able to, we're in there with the anesthesia team, we have the nurses in there, I'm with a faculty member, and we do have dental students from the dental school that come and rotate. So a lot of times they'll be in there with me assisting. So I'm kind of able to like talk them through what I'm doing. So I really enjoy OR days. Again, I get a ton of experience with restorative, and we do a ton of extractions, and it's a controlled environment, so the patient's not awake to really know what's going on. So it gives you more of that ability for your faculty to kind of explain steps to you, whereas if you're seeing a patient in clinic and you're kind of talking shop, it would freak them out. So yeah, I do enjoy ORs because I get to learn a lot from my faculty, and then I also get to kind of teach some of the dental students. So I enjoy OR days.
Awesome. That's going to conclude our session, guys. The post-session quiz is in the chat, and it's going to be in our link tree. So thank you so much, Dr. O'Mara, for this awesome
Thank you.
session.
Thank you so much, Hannah.